So nasal obstruction is simply the inability to easily breathe through your nose. There are a lot of different things that can cause this. The most common things we see are things like allergies and what's called non-allergic rhinitis, and also structural problems like a deviated septum or large turbinates. Nasal obstruction can affect a lot of different aspects of your life. Most commonly things like difficulty sleeping, snoring, waking up throughout the night, feeling like you can't breathe very well. It can also affect your ability to easily exercise and just make you feel really uncomfortable throughout the day. So there are a few different causes of nasal obstruction, so there are also multiple treatment options. Most common ways we fix nasal obstruction are things like fixing a deviated septum, that's called a septoplasty, or reducing the size of the turbinates, which is called an inferior turbinate reduction, and also treating what's called the nasal valve, which is the area at the front of your nose that provides resistance to airflow. It's also important that we treat any inflammation of the nose, so that's where things like managing allergies and chronic sinus issues are also important. Nasal blockage can be distressing, and many people are looking for ways to quickly unblock the nose. Things that we often recommend are over-the-counter nasal steroid sprays like Flonase, and also nasal saline irrigations or the neti pot. We usually start with those non-surgical options, and then if that doesn't work, then there are multiple other treatment options that we have to offer. When we see a patient for nasal blockage, things I'm commonly looking for are things like a deviated nasal septum or large turbinates, and then evidence of inflammatory conditions like allergic rhinitis. Here at Capital ENT, we provide personalized, comprehensive, state-of-the-art care for any nasal, sinus, or sleep issues that you may be experiencing.